Go.
Hi, I'm Dr. Kay Smith, one of the GPs at Avondale Medical Practice. One of the two practices is Stephen Health Centre, and we thought it would be a good idea to let you know what's been happening in the health centre since the coronavirus emergency over the past couple of weeks. As you probably realise, we're keen not to bring people down into the health centre, and for that reason we've had to change the way that we do our general practice. The main thing is that when you phone up now for an appointment, all our appointments are going to be on telephone triage, and that means that when you phone in the morning, our reception staff will take your name, take your telephone number, and will ask for a rough idea as to what's happening with you. The reception staff aren't being nosy or aren't prying. The doctors are asking that we find out what's wrong with you so that we can prioritise when we phone you back. What will then happen is that one of the doctors will give you a phone call, but we can't guarantee when we'll phone you back and which doctor will phone you, but we will try and get back to you as soon as we can. It's a different way to consult, and the doctors find this a completely new way and somewhat stressful, both for yourselves but also for the doctors as well. So bear with us, bear with our reception staff as well, because they've had a quick training in this as well, so it's all new to us and a bit different. As you know, the government are wanting to keep people indoors as much as they can, and that includes being down in the health centre as well. We don't want people mixing who potentially might be unwell, or patients who are more at risk. So the main thing is not to come to the health centre unless you've been told to come down to by one of the doctors. There will be times when we do a telephone consultation when we feel it's appropriate that the doctor will see you, and if that's the case, the doctor will tell you a time to come down to the health centre and have an appointment. If we do ask you to come down, there are a number of things that we'll ask you to do. When you come in the front door, we'll want you to use the hand sanitizer, which is on the wall just as you come into reception. Make sure that you use that before you come into the building. When you come up to the desk, you will find that there is a white line, and we would prefer that you stood behind that white line, which will give a degree of social distancing from yourself and from the reception staff. We'll also note that the reception staff are keeping their shutters closed, again to protect you and to protect them as well. As per usual, if you are in the building, have a seat in our reception area, which you will see we have separated the chairs out, again to keep your distance. Please respect that, don't sit right next to somebody else in the waiting room. On occasions, we will have to see you if you've got a respiratory illness, and that involves us doing something different, because we have to keep all patients with respiratory symptoms separate from the rest of the building. And in that case, I'll show you what to do. We're down at this part of the building. We have managed to separate part of the building off from the main part of the reception, so that any patients coming in will be seen in a different way, and I'll explain now what we want to do. When you're asked to come down for a respiratory appointment, we will ask you to bring your car down and park at the end of the staff car parking, where you will see that there's coned off areas, and when you come down, move the cones and park your car. Stay in the car and then phone reception, and the doctor will then tell you what to do. What we will do is we'll come and meet you at this door, and the doctor will let you in this part of the building. When you come in, the doctor will probably be dressed like this. This is not trying to be wannabe stars on obesity or A&E. It's more practical for us to be dressed like this in case we see somebody who may be infected. We'll also probably find that the doctor will have an apron on, a pair of gloves, a mask, a protective visor, and the doctor will then bring you into the consulting room in here. If you're coming down with children, and we have to examine some children in this way, it might be a good idea to kind of pre-warn them that we might be dressed differently in case they're a bit worried by that. But there's nothing to worry about. It's just protection for us, and it's protection for you as well. Once you're examined in the room and deciding what we have to do, we will then let you out the same way. So the only difference is it's a different entrance just for everybody's safety. And finally, if you get a prescription, a couple of changes have happened with the prescriptions in the practice. We are trying not to do early prescriptions, and we would ask that all prescriptions are done at the usual time, and that you wouldn't ask for things you don't normally get, don't ask for extra amounts, and don't order excessively early. We won't be able to do that. There's no problem with the medicine supply chain, and all medicines are getting through. The problems with the chemists have been there's been too many people asking for too many things all at one time, and that has caused problems with the local pharmacists. The pharmacists have asked us that if you're phoning up for your usual repeats, to give 7 days notice rather than the usual 3 days. Also, if the doctor is going to give you a prescription on the day or from your telephone consultation, all our prescriptions from this practice will go to the Green Street chemist. All prescriptions from the other practice in the building are going to the Common Green pharmacy. I know this is difficult, I know it's a difference to what we normally do, but we hope that you will bear with us as we have this transformation in our general practice over the next couple of months. Take advice from the government as it comes out, remember your social distancing, stay at home, and if you need further advice, you can check with NHS Inform online or use the government webpage at www.gov.uk, and we hope that you'll take care and that you'll stay safe, and that in a couple of months' time we'll get back to normal and we'll see you back in the building as we once did. If there's any further information we want to give, we might post another film, but we'll let you know that when it comes out. Thank you.